Hi, I'm Tracy Stein. I'm a health psychologist and the author of the award-winning book, The Everything Guide to Integrative Pain Management. And one thing I focus on in the book that I'd like to share with you in part here is how to know when it's time to find a new pain doctor, because that can be a really difficult decision to make. But one thing to keep in mind is if you've been seeing somebody for a long time, 6 months, a year, and your pain hasn't really changed at all, despite trying a few different treatments, that might be a time to talk to your doctor about getting another opinion. Another reason why you might want to change pain doctors is that you present with some of the other symptoms that people typically have when they have chronic pain, like sleep issues or depression or anxiety or other distress, but they seem to dismiss these symptoms. They're actually things that it's really important to treat when you're treating chronic pain. Another reason you might want to consider changing your pain doctor is if they can only really offer you one treatment option or a limited number of options, and those options don't seem to be helpful, or they're things that you aren't comfortable trying. So hopefully your doctor is able to discuss a range of different options with you, but if that doesn't seem to be the case, it's also worth considering getting another opinion. And certainly, if you feel like your doctor doesn't listen to you, that is a really good indicator that it's going to be difficult being honest with them or feeling like you can get sufficient help out of your treatment. And another reason you might want to consider switching doctors is if you feel like they're really just dismissive of other therapies that you're trying that they may not be familiar with, but that may be helping your pain. And certainly, even if they feel like that isn't the best treatment for you, they should be willing to familiarize themselves with the treatment and discuss it with you. And finally, there may come a time when either of you, or maybe both of you, decide that the relationship, the clinical relationship, just isn't the right fit. And again, you're not making enough progress, or there are other issues, and maybe it's time to find someone new. And ideally, your current pain provider may be able to give you the names of other providers who might be a better fit. But if you're left feeling like you need to find somebody new on your own, here are some other resources that you may wish to consult. There are more in the book, but one would be the American Board of Medical Specialties. Another would be the American Academy of Pain Medicine. Or if you are hoping for a more holistic physician approach, the American Osteopathic Association could be another place to look. You may also wish to look at the National Center for Complementary and Integrative Health. Their website will contain patient information on pain and other helpful links. You might also consult the American Chronic Pain Association's website or the American Psychological Association's website. And this last resource can help you to find a therapist near you who is skilled at treating pain. So I hope this is helpful. For more information, you may wish to obtain a copy of my award-winning book, The Everything Guide to Integrative Pain Management, and it's available at Amazon.com, BarnesandNoble.com, and other booksellers.